there may be some people filtering in, but I'll go ahead and welcome you to this seminar. I'm so glad people could make it. I know this time of year and with finals, it's a little dicey. So I'm so glad you could all be here. My name's Ashley Brooks Russell. I'm an assistant professor in community and behavioral health and a core faculty member in the program for injury prevention, education, and research, which is helping to sponsor this seminar. And Sarah's passing out evaluations that we do for all our seminars. And just before we get started, I'll let you know of an upcoming seminar that Piper's also putting on suicide prevention for emergency room patients. Ed Bordeaux is visiting, and that will be on December 17th from 12 to 1 in Academic 1 in the surgery conference room. Anything else I should say about that?
There'll be snacks.
There'll be snacks at that one. That's rare, so it's worth noting. So I'm very excited for this seminar. I'd like to share some history because it's a little atypical from other seminars we've produced. The origin of this one is actually an MPH student in our department who, through an independent study that I was involved with over the summer, Jenny Deserich, who's very interested in this topic, sought out local experts, practitioners in this field of sexual violence prevention, and talked with them as well as conducted some other activities related to an independent study. So this actually grew out of that work, and it's I don't know if we don't have many other examples of a student putting together a panel. So very excited about that, and I'll let Jenny do some further introductions of our panelists. But just to give you a sense of the format, each of our three guests will speak for 5 to 10 minutes or a few minutes about the work that they're doing and their perspectives on sexual violence and gaps they see in their work and any observations they have. And then we've left quite a bit of time for discussion. We want this to be informal, so I think probably it's okay if people have questions during, and then we'll have quite a bit of time for discussion from the audience. So it's a little less didactic than most seminars. And with that, I'll turn it over to Jenny to do introductions.
Okay. So yes, I am Jenny Deserich. Some of you know me, some of you don't. And welcome to all of you. Thank you for coming. As Ashley was saying, this is a subject that I am very interested in, and I was fortunate enough to be able to put together an independent study over the summer, and then was able to actually build a little bit more of it this fall. So I really started out with wanting to understand as in public health. We all want to know that, and that is very, very key into justifying measures of prevention. And I wanted to know the significance and severity of it, as well as any subpopulations that were a little bit more affected, and ideas on prevention and what's currently going on, what is CDC doing, what are other organizations doing. And I'm happy to say, well, sort of happy to say there is a lot going on in this particular field. But what I'm excited about is this panel might give us the opportunity to think about things in ideas in prevention with a few more perspectives. So I have Tommy Kuehl from the Sexual Violence Prevention Program at CDPHE, and then I also have Michelle Metz, who is a SANE nurse at Denver Health. So she'll be giving you the clinical perspective and talking about some programs that are currently going on. And then I have Kylie Mallory Helter from the Phoenix Center, which I have a personal interest in. I am lucky to be a volunteer there as a victims advocate working on the helpline. And Kylie is going to give us more of a perspective on the victim services side of thing. And you will see Anthony's name up there, and unfortunately he's ill today and just was completely unable to make it. The law enforcement perspective and the judicial side of things is very important, but fortunately we have a little bit of expertise, well actually a lot of bit of expertise up here between Michelle and Kylie. Obviously they are not law enforcement, but they can provide a little bit of that perspective and how they work within the system, the judiciary system, with survivors. So I'm not going to spend too much time on this, and Ashley will wave at me or yell at me if I go over time. Sure. So in public health, we all know that case definitions are very, very important. And CDC gives 7 definitions. I actually have combined 2 of them, the first 2. I don't want to read them aloud to you because you guys can all see this. But it's important to understand that sexual violence doesn't just mean sexual assault. It encompasses unwanted sexual contact and non-contact unwanted sexual experiences, such as stalking. So these are a pretty good list of the definitions. And what we have on here is the lifetime prevalence of sexual violence. Nationally, it's 44.8%. And in Colorado, which I'm hoping Tommy might be able to speak to a little bit, it's actually a little bit higher. And so it's really important for us here to look at prevention approaches, and there's quite a bit of work going on, but thinking ahead is always good. And then we have the race and ethnicity breakdown. These are percentages for sexual violence. I do, in fact, have percentages for actual rapes, meaning forced penetration or being forced to penetrate someone else. And women of color are disproportionately affected. So you can kind of see what we're looking at there. And then we have 1 in 5 women who've been raped in the United States. And 84.9% of those instances are by someone that they know. So this is considered part of what is called interpersonal or intimate partner violence. And that is why we can think of focusing our efforts on working with youth, teaching healthy dating relationships so it doesn't progress this far, and hopefully help that way. And as you can see, age is a factor as well, with 79.6 people having experienced rapes before the age of 25. And this particular statistic at the bottom, 25 to 68% of events go unreported. This is according to the Centers for Disease Control. And this is where I feel like this panel has a lot to contribute about this. Anthony, as well, in the law enforcement perspective, talked quite a bit about dealing with training officers and working with the law enforcement community to see if we can create an atmosphere of more believability and making it hopefully a little bit easier to report. And we're looking at health effects, which the obvious consequences that a lot of us think of are physical, emotional, psychological, and then a lot of people don't necessarily think of the social and financial sides of things. So this is a societal as well as community issue. We can have strained relationships, people missing work, school, and it changes the trajectory of your entire life. And the financial is something that we all know, trying to get things funded that people want to see. How much does it cost? Prevention, as you can see, could be a very, very good thing because it's estimated that per event, that means per sexual violence incident, $87,000 to $240,776. That includes the immediate medical consequences, going to the ED for any kinds of immediate injuries, testing, exposures that you may get to any number of infectious diseases. And it also includes the loss of productivity, loss of jobs, missing days of work and school, which is something that's very important, and it decreases your years of quality of life. And there is a paper that I've listed here if you're interested in the economics of this situation that they have actually calculated at the, let's see if I can say it right, the White House Office of Women's Affairs, I think. They've done some equations that have helped them arrive at these figures. So in the interviews that I've done and just kind of my hypotheses for prevention were, okay, what can we do? My biggest thing in thinking about prevention in the very beginning was what are the efforts out there that we can possibly do that don't involve decreasing risk factors, because to me that indicates that you did something wrong. You did something to deserve this. So if you did X, Y, and Z differently, it wouldn't happen to you, or it wouldn't happen to your loved one. And so one of the things that I got out of interviewing Tommy was that we can work on increasing protective factors. And she'll go into what some of those are a little bit more when she's talking. But then also long-term, we need to change social norms and decrease gender inequity, where this is no longer acceptable. So these are things that you can think about. And then also harsher legal penalties could have the potential to deter would-be perpetrators, but a lot of times violence is, it happens in moments where you are not experiencing clarity, so you're not thinking, oh, hey, if I do this, this is going to happen. And I was also informed that Colorado, according to Anthony, has some of the most inclusive and harsher statutes for, prosecuting would-be perpetrators, but it still depends on what prosecutors are willing to take on, what they think they can win, and what kind of evidence they feel that they have and how they can move forward, and also should depend on the survivor and what he or she wants. So right now, we're going to turn it over to Tommy. We have our public health perspective. Then we're going to follow that up with our clinical perspective and the SANE nurse, Michelle. And then we are going to conclude with a little bit of information from Kylie. And then we'll open it up to questions. And we really hope to create a safe environment in here to have a productive discussion. Thank you.
Thanks, Jenny. Thanks for the opportunity for coordinating this. So as mentioned, my name is Tommy Keel. I am the Unit Supervisor for the Sexual Violence Prevention Program at CDPHE, the Department of Public Health and Environment. And we are situated in the Violence and Injury Prevention Mental Health Promotion branch, which is a mouthful, but it basically means we've got marijuana and prescription drugs and all kinds of violence in our branch. So just to give you some context, which is a little bit important once I get to connecting the dots and shared risk and protective factors. So I'll get into that a little bit more later. So I wanted to clarify one thing, because I think one thing that distinguishes our program from the rest of the panel is that we're really focused on first-time perpetration prevention. We're not focused on victimization per se. We think that will go away if we can prevent perpetration from happening. So that's a little bit different from the victim prevention field. And it's not universally done across the board. So our funding comes from the CDC, from the Rape Prevention and Education funding, and each state is granted that money. And we get a lot of flexibility in terms of crafting what our strategies look like, because I think, as everybody probably knows, we're not totally sure what works in preventing sexual violence. The research is pretty new. They have just released some funding for some pretty big research projects, which we're hoping will help us better understand the issue of sexual violence and what really works to prevent it. But the research is very new. And so, as I mentioned, so we are really focused on risk and protective factors. And risk factors, and I'm just going to grab this, connecting the dots. Risk factors are those things that make it more likely that someone will experience some type of violence. It's not causal by any means. And then protective factors are the things that either buffer somebody from experiencing violence or build their resiliency should they ever experience violence. And this document is called Connecting the Dots, and I have copies for folks if you're interested in grabbing them at the end. And I'll get into a shared risk and protective factor approach, but the idea really is that there are shared risk and protective factors across multiple types of violence. So how do we leverage with our partners in other violence prevention fields to have a more robust, comprehensive approach to end sexual violence that's not isolated or siloed? So I'll get to that in a little bit. We are currently focused on prevention at the middle and high school level, so we are funding programs in schools largely, or after-school programs. That is only one small part of sexual violence. We are not working at all with child sexual abuse. Our funding just doesn't, we don't have enough funding. We get about $600,000 a year, and we fund that out. And so we just had to kind of carve out what our purview was, and so that's where we landed. And largely because I think from the data that you shared, 42% of people experience some sort of sexual violence before the age of 18. So that was one of the reasons we did that. So we are currently funding 8 community-based agencies across the state, and they are working at multiple levels of the social ecology. At the first individual level, a lot of them are doing healthy relationship classes. There's a few curriculums that are promising practice, like safe dates, that are really focused on identifying healthy relationships, consent, gender norms, those kinds of things. And then at the relationship level, we are trying to work with parents and teachers to help educate them on how do you talk to young people about your values around sex, because I think that's a big barrier, is that we don't, as adults, know how to actually interact with young people around these issues. And then the third area that we're working in is policy, and specifically comprehensive sexual health. If you don't know, in Colorado, we're an if-then state, meaning if you offer sexual health, then it needs to be comprehensive. So that means basically you don't have to offer sexual health at all. Or if you do, you're supposed to make sure that it's comprehensive, but no one actually regulates that. So we have a lot of diverse things happening in our schools. We hear from grantees about lots of abstinence only. Our state gets a lot of abstinence only funding. Or we hear about gym teachers who have no training and are showing pictures of STDs broadly. And so there's a real gap in that. And then the second policy that we're interested in working on is the bullying prevention policy. So it's a national requirement that states have a bullying prevention policy, and Colorado actually has pretty strong legislation around it. The problem is the implementation piece. So we're really looking at how do we enumerate specific populations around this, largely LGBTQ youth and young people with disabilities. And where the gap really comes in is that most young people are not feeling supported with the policies that exist in their schools. The school does not respond appropriately, or they don't have the tools or training to do so. So we're trying to help work with schools to do that. So the gaps in prevention, I think one of the biggest gaps is the way we silo our violence prevention work. We all get various funding streams and sources and have specific outcomes that we have to reach, and it makes it sometimes challenging to connect and collaborate. And I think the answer to this solution is, again, connecting the dots, which I spoke about. And this is really that idea of how do we find ways to partner and leverage our resources. And so maybe we think differently about what we're measuring and evaluating to partner with suicide prevention or child abuse prevention or youth systems building or positive youth development. There's lots of opportunities. So the example I'm giving you here is a visual, and in the back of this document you'll see a table which actually outlines all of the research to date around where shared risk and protective factors happen across multiple types of violence. So it's a really great document to get you thinking strategically. But this example, this visual, is all of the outer ring with various types of violence, so bullying, teen dating violence, sexual violence, suicide, youth marijuana use, which is a new one since our branch has marijuana prevention in it. We have been doing some research on our own, adding marijuana use to this existing document, and then youth violence. So all of those in various types of research have seen school connectedness as a protective factor for all of those things. So by our logic, what would make most sense is to fund programming that addresses school connectedness and see outcomes and measure outcomes for all of those types of violence. And that's how we can bring our partners to the table, because there's that commonality. We don't have to get caught up in sort of the minutia of our expertise in various fields, which I think is a barrier. Let me see if I can... Let me back up, so I have one different slide. So one of the ways that we're doing this, I think the other problem with public health, frankly, is that we often get stuck in the theory and aren't very good at talking about how do we apply this and actually do the work. And so one of the ways that we're trying and testing this out is we are currently, with our rape prevention and education funding, funding 7 pilot schools across the state, and they are implementing a suicide prevention program. It's on the SAMHSA NREP registry. And it is a primary prevention approach to suicide prevention and has shown impact on the protective factor school connectedness, youth adult connectedness, amongst other outcomes as well. And we are piloting using that programming. We're using our SVP evaluation tool, which all of our grantees currently use, which measure and evaluate across various risk and protective factors. And we're trying to figure out if we can see an impact on the things that we're looking at, like gender norms or healthy relationships, even if we're not talking about sexual violence, using a youth suicide prevention program. We've also added this year a school connectedness scale to that survey tool because we want to figure out what's important for sexual violence related to school connectedness and what's important for suicide, and are they the same thing. So we're hopeful to see something next year. We just have the pre-tests out. We'll know something by the end of this next school year. If that's true or not, we'll see. So that's kind of how we're thinking about it. So where do we go from here? I'm very big on how do we de-silo this issue? And the other piece, frankly, is that we have focused the majority of our funding on individual level interventions and haven't done much to change the context in which people are then going home and experiencing multiple things with their families or friends. And so how do we maybe think more broadly about our prevention dollars to address the contextual problems? And so one of the ways that we're thinking about it within our program is how can we partner with other youth violence prevention programs in the state so that they're largely focusing on the individual level, still sustaining those services because they're very important. But how do we then move up and focus on those policies, practices, and norms so that we can have a more comprehensive approach? Most of the research is focused on individual level. Most of the strategies being implemented are individual level, and it's really important, but it's not enough if we're not changing the context at the same time. So the context changes can look like education, hotspot mapping. I don't know if folks are familiar with that, but various environmental strategies. For example, a hotspot mapping would be where young people are identifying in their school places where they feel safe or not safe, and then you make an environmental change. You add a teacher to that space during recess, or you add lighting. Various things are kind of simple to do, but we haven't really invested the money to look at how effective those are for various outcomes. And in terms of who we should target for education, to me, this is, again, the context piece. Like, the individual piece is really important, and we want people to individually change their behaviors. But if the context doesn't change, I'm not sure how we get to that in a sustainable way. And so my question that I would pose to all of you to think about is, can we change the environment without addressing behavior change at all? I don't know. Like, that's one of the things that we're kind of considering and thinking about. So that's who we are in a nutshell.
I guess I'm standing up.
All right.
Let me just move over so then you can just see mine. So obviously what I do is very different because mostly what I do is all victim focused, as in it's my patient who comes to see me acutely after their assault. So what a SANE nurse is we are specially trained nurses, registered nurses. Some are advanced practice, like nurse practitioners and stuff like that. But we do critical care nursing for a while, and then we go to classes to learn how to deal with victims of interpersonal violence. We also take care of, and when I say interpersonal violence, so then people get really hung up on verbiage, and I mean, I almost started to argue with a patient one time about, because I said sexual assault. She goes, I was not sexually assaulted, I was raped. Okay, like, absolutely, I get that. And, but we kind of tend to say that. Or if you say that somebody was raped to someone else, they assume it's a stranger who's jumping out of the alley and who's doing something to them. So anyway, so interpersonal violence is just across the board. It covers everything. We do, when somebody comes in to see us, actually at Denver Health we're pretty lucky. We have worked really hard on, first and foremost, not charging patients unless they have to get charged. So when you're talking about the cost of it, they don't ever get charged for an exam, but we don't charge them to come into the hospital. A lot of other places, they will get a bill just to have a doctor come in and say that they're okay. If they need to see a doctor, then they will see a doctor, and if it needs to be billed, if they need x-rays, that's a different side. But a lot of our patients, about 30%, need to see a physician. Otherwise, they don't. So that doesn't happen there, which is good. We have social workers on 24/7, except for like this 2-hour gap that we don't on Saturdays, which is really painful. But it's awesome, honestly, because the social worker goes in there and talks to them about what their options are. So that's, I tend to really focus, too, on taking care of that patient who's in front of us is what is going to make the difference for them. When we're talking prevention versus, because it's happened now to my patient, so I want to make sure that we do everything we can in that moment that they're with us to then change their trajectory so it isn't going to be a bad one. Anyhow, so in Colorado, you basically have 3 choices if you want to do the medical forensic exam. You can report to the police and do it. You can medically report, so the police have your name and your birth date, but that's it, and do the exam, or you can be completely anonymous and still have the exam and the evidence collected, just the police have no idea who you are, sort of thing. So social work goes in and talks to them about that, offers up community resources. They're the ones that coordinate the care with us. We come in and we do the exam, and the first thing I say to all those patients, too, is it's their exam, not mine. So if there's something they're not okay with, they don't want to do, we're not going to do it. I'll explain why it's important. However, I'm not doing something they don't want. Sexual assault is about power and control. I think that's what gets sticky when you're talking about prevention. I think that we do have a subset of perpetrators who have no idea that they're perpetrating. I really do. And this isn't me putting blame on anybody else or anything like that, but look at our media. The Katy Perry song last Friday night, right? I got all drunk and had a menage a trois, I don't remember. Well, technically, if you don't remember, that's kind of assault. Or I was in Vegas. My poor husband, I swear someday he'll leave me. We're in Vegas, and we go walking by these T-shirts, and there's a T-shirt that says, 2 shots tequila, $15.80, 4 margaritas, $38.60, 5 beers, however much. Taking the girl home who drank that, priceless. Okay, so as a young male, you know what I'm saying? You look at that, and this is what our society says is okay. So, and you ask him, well, how drunk was she? Well, she couldn't tell me her name, but I'm sure she liked it. There are perpetrators out there who are definitely targeting those people, absolutely, and they know 100% what they're doing. But I also think we need to change all the things that we're telling people, because it does get confusing. Well, but everything says it's okay, because drunk sex is not illegal. Incapacitated sex is illegal. Sorry, I just got on my little soapbox. I do work very closely with law enforcement, particularly Denver. And I think that's a big part of it. Again, how we address things on the front end. And it's not necessarily prevention, but it's taking care of the patient or the victim who's in front of us. And how they interact with law enforcement will be what decides where we go from there. So if we're looking at prosecution and penalties and all that stuff, we still got to get the people in the door to ever even get to that point. We can't hold anybody accountable if we're not taking care of our victims on the front end appropriately. Denver, in March, they rolled out Start by Believing. And I don't know, did anybody happen to see any of the billboards or the bus, the bus stops where they had kind of posters of people, Start by Believing? It's awesome. So the whole idea is we're working towards culture change, and we're working towards having the first person you go to talk to that something happened to you, because most of our patients, I can tell you, I've done well over 400 exams. Most patients who I talk to, like their stories, they are initially so confused, and there's guilt and humiliation with it. So the first person who you tell, I don't know really what this necessarily was, because a lot of it, that's what it is. You know, I went out and I met somebody and these things happened, and a lot of our people freeze because they don't, I mean, freezing, fight, flight is what we think of our reactions. It's freeze. That's what the bulk of my patients do is freeze. But so the first person who they say, hey, this happened, we need to make sure that they don't go, oh, you're overreacting, or, well, you were drunk, or whatever. So that was the whole idea behind Start by Believing. Law enforcement changing their way of looking at things, the way they interact with patients, and then on down. But here's another problem when we're looking at even utilizing that. We can't use the word sex assault. Can't use the word rape because it makes people uncomfortable. So we're going to have these posters that say Start by Believing. Well, what are we believing? You know? I mean, seriously, and that was one of our we had all these meetings about trying to do this really strong message. Nobody wants to talk about it because it makes them uncomfortable. So I think our biggest barrier to any kind of doing anything prevention-wise is having people be willing to have that conversation. You know, making those words become normal. And I hate to say it, but that's exactly what it is. They aren't dirty words in the sense of we need to be able to talk about it. We can now talk about suicide, which years ago we have to grow, I think, as a society. When we're talking about our vulnerable subpopulations, so I work at a level 1 trauma center that's a safety net hospital in Denver. I see a very different population than what they see at Littleton, first off. But the things that I really see is anybody with any major mental health issues, substance abuse issues, in particular, they're great victims. And I don't mean that the way that sounds, but they really are. They're marginalized. People aren't going to necessarily believe them. If you have a really long psychiatric history and you get delusions, as a perpetrator, that's a great victim, right? Because nobody's going to believe them. And remember, it's all about power and control. Transgender, we have opened up a clinic at Denver Health, and I honestly think this is why we're starting to see more transgender people, because we really weren't seeing any, and we've seen a few. There's a huge distrust for the medical community. There's a huge distrust, with law enforcement and all that. So they're not going to outcry and come in. We see a good number of males at Denver Health. I think it's where we're at. I also think it's all of our other sub-clinics that make people, they go there for their care. A lot of people go there to the STD clinic. So because of that, they feel a little bit more comfortable maybe. But yeah, sorry, I get off on these little tangents. So Start by Believing is and that's exactly what it looks like, which again, it's pretty. It's awesome, isn't it? And I'm super excited. I really am. So it was me. So I was there from the clinical standpoint. We had law enforcement there. We have, I'm trying to think of everybody at the table, like health and safety. So even the sheriff's department and fire. And then we also had Carmen from the Blue Bench there. So sitting there trying to figure out a way to get this across. This was completely started by Denver Police, by the Sex Crimes Unit. You know what, and to be very honest, the Sex Crimes Unit at Denver Police is awesome. They really do. They're great, but it's really hard to get that sometimes a message across to all the patrol officers that are out there. And I absolutely love when I have an officer, which doesn't happen so much in Denver now, but I'll have one from an outside, community goes, so did it really happen? Yes. What are you wanting from me? This is what they said happened, so this is what happened. Well, did you look down there? Couldn't you tell? No, you can't. Oh yeah, absolutely. Those are the kind of questions that you get. So I get to educate, which is awesome. I get to educate. I've started up now yearly having the field training officers and some of the multidisciplinary teams coming in to come and talk with us and just explaining what goes on and why we do the things we do and stuff. And I think that's also helped. But again, I know this isn't like long-term prevention, but it's these types of things that at least help in the moment, because we're never going to make it all completely go away. I mean, even just from the domestic violence standpoint, again, we're talking power and control, and it's a way to control that person who's in front of you. So we can't completely get rid of it. So we got to make sure that we take care of people appropriately afterwards. And then Safe Bars is a new program that the Blue Bench is starting up, where they're going to some of the bars downtown and really training the staff at the bars and training so there's quite a few police officers who do off-duty stuff at the bars, like the View House and things like that, and going in and educating what to watch for if somebody is too intoxicated. Like if somebody is putting someone over their shoulder and carrying them out, making sure it's somebody they should be carrying out and not just some random person who's there. So there's all of that whole idea, though. In Denver, police are all worried that if we throw that up there, then and something happens, is somebody liable now? Because we said this is a safe bar. Right? But the hope is it's just, it's kind of bystander interventions, too. I mean, we should train bystanders when they notice something's going on to step in or to distract. I do that with my kids when we talk about when something happens on the playground. If you don't always feel comfortable going in and getting in the middle of it, so then you tell somebody to go in. I think for prevention, too, I think we need to start in elementary school. You can very appropriately talk about what is appropriate touching and consent. I have a 9-year-old son who loves everybody a little too much and a little too physically. And having that conversation, like, you can't just go up and hug and kiss people if they don't want you to hug and kiss them. My biggest fear, I'm serious, I'm going to find out later on that he touched somebody inappropriately, and I swear he just meant to love you. But that's one of the things is with the little kids, they start out in kindergarten now talking about what you put online. Like, be very careful about the things you put online because you can't take them off. I had my daughter come home when she was in kindergarten going, did you put that on Facebook? Because it's on there forever. We can't get rid of that. So if we can have that conversation, why can't we have the conversation about consent? We're not talking sex. We're not telling kindergartners that they can have sex with other people or they should be having sex, but saying don't hug somebody unless they want you to hug them. So that's, yes, I just think we should talk in the schools. But you will be surprised how hard it is. I had started looking into doing that because we want to do more too, and about getting some of the nurses in there. People don't want you coming in, and you got lots of parents who don't want you talking about any of that stuff. When we were talking about the sex education, we all have to opt in. So for my 5th grader to get it, I have to sign a letter saying it's okay for you to talk to her about reproduction and such. That needs to go away. Oh, wait, and I already said all that stuff. So I think we need to get into the elementary schools and just talk about stuff age appropriately. And I think bystanders and just getting people feeling comfortable saying something or doing something. Has anybody ever heard of the Green Dot Project out of University of Kentucky?
Yeah.
Have you ever watched her speak? She's amazing. Like, she gets y'all excited. I'm going to change the world just because of her. But I think that's very true, and she had told a story about at a frat house, and I think that's it. You can't wait until college to teach kids this stuff. But one of the guys, he saw one of his frat buddies, whatever, brings a drunk girl up to the room, and he yells out, "Oh, dude, I think they're towing your car." So he didn't have to lose, because, you don't want to lose face, in front of your people, but he completely diffused it without even truly getting involved. So I thought that was kind of cool. So things along those lines. All right, sorry.
No, you're good. All right. Hard acts to follow. So my name is Kylie, and I'm the Victim Services Coordinator for the Phoenix Center at Auraria. So we serve all students, faculty, and staff for Metro, UCD, and CCD around issues of interpersonal violence. So stalking, sexual harassment, sexual assault, domestic violence, dating violence, all of the above. Our office also does prevention work on the Auraria campus. So we have 2 of our prevention educators here. So they go into the classrooms and they have these conversations about consent, about gender. They talk about minorities in the media, bystander intervention, just kind of all those different pieces around campus. So in a nutshell, that's what our office does. We are small but mighty. So as far as, from my perspective, in my current position is really focused on the university level. And so right now, multiple schools in Colorado are under investigation for Title IX violations. There were 37 domestic violence-related deaths last year. In K-12, I used to work in K-12 a lot. They're not talking about this issue, they are not keeping track of issues like dating violence. That's not something that they have to code, at least in Denver, in IC. Oh, sure. So Title IX is federal law that has to do with gender discrimination for basically any institution that's receiving federal funding, right? You have to abide by federal law. And so issues such as stalking and sexual assault, domestic violence, all of those issues create a learning environment, right, where a person would not have equal access to education, right? If your perpetrator is in your math class, you cannot be expected to go to your math class. And so the schools have Title IX processes in place where an individual can make a complaint to the school. And this is a separate process from reporting to the police. So you can make a report to the school of a Title IX violation. The school has an investigator. So Anthony is one of the investigators for CU Denver. They do an investigation, they interview both parties, and then they make a determination. The burden of proof is less than in a criminal justice proceeding. It's reasonable. Don't quote me on the exact language for what the standard is. But regardless, they make a determination of responsible or not responsible for the other person. And then if a person is found responsible of violating Title IX, violating the school code of conduct, then there are various sanctions that can go into place. So, I mean, on the extreme side, right, it would be expulsion, suspension, and then there's lesser penalties around, involvement in various activities on campus, or sometimes there's reflection papers, things like that kind of go into place. So that's kind of the spectrum of what Title IX does. Have folks heard of Title IX before? Some nodding. Okay. Cool. So as far as the population that we're working with primarily, certainly on my end as the victim services person, our campus, the Auraria campus is extremely diverse. And we really do, I think, see that diversity reflected on our caseload. So we're working with every type of person around almost any issue you can imagine. Interestingly, I feel like I get a lot of folks who come in who experienced child abuse. We were talking about sort of starting at younger ages, right? Who experienced child abuse. Now they're 20 years old. They walk into my office and they've never told anyone before, and this is the first time that they're disclosing it. And it's a lot of, did this actually happen? Was this okay? So I'm also going to talk about prevention in schools. So I'm going to sound a little like a broken record, but. So, as far as vulnerable populations, one thing that we face a lot are barriers to reporting. And I think it's twofold. Some of it has to do with how they are responded to initially. So just like what Michelle was saying, right? Sometimes, the beat cop that rolls up to take that initial report is, not that great. However, there are other cops that are fabulous, and we actually have an amazing relationship with the Sex Crimes Department, with Denver PD, and one of the investigators in particular, she takes all of our reports, and she is just amazing. I cannot say enough great things about her. So, I think that for continuing, there are great law enforcement folks out there, but continuing that education, continuing to get those really good folks in there. The systems are really complicated and really victim blamey, right? You sit down and you answer the same question 5 times about why you were there. You answer the same question 5 times. So, what's your relationship with that person? It's really hard. It's really hard to go through that reporting process. On top of the fact that the system is complicated, also, right, we know that various populations feel disempowered to go to law enforcement to begin with, or the school, whether it's for personal experience or historical experiences of being marginalized by police, by law enforcement, and just not being protected by those groups. I think transgender is another population, right, that is really wary of reporting, and for very understandable reasons. So that's something that I've definitely noticed with clients. We have a pretty full caseload. I have a full caseload. Very, very few of my clients are actually reporting to systems. Very, very few. So yeah, prevention. Oh man, I could talk about prevention for like a really long time. So previous to my current role, I did a lot of prevention work in K-12, and I'm going to just really mirror exactly what these guys said, as these people said, as far as we need more sex ed. We need more connecting the dots. I love that connecting the dots report. Like, if you haven't read it, you absolutely must. It's mandatory. Read it. I think Tommy shared it with me like a year ago or a year and a half ago at this point. And I like keep them in my purse and will pass them out. I've given them to friends and been like, I really think you should read this. It's light reading. No, I think it's really valuable. And having worked in nonprofits that do prevention work, that siloed impact, that competition for funding is a really big deal. So if we can get into a situation where we're not competing for funding and instead we're sort of collaboratively thinking about prevention from a long-term perspective, thinking about the community as a whole, some schools out there are inundated with various prevention efforts, whether it's substance use or teen dating violence or gang violence, whatever it is. Other schools have nothing at all. Why is that? I think that those are the kinds of questions that we really need to be thinking about from a community standpoint so that we can effectively impact an entire district, an entire community. As far as for the little itty-bitty ones, the only organization that I know in Denver that's doing that work is DCAC, Denver Children's Advocacy Center. They have a program called Denver Safe from the Start, and it's really focused on safety. And so it's like, how do you be safe with tobacco? How do you be safe with being home alone? Or how do you cross the street wearing a seatbelt, a helmet, etc.? And then they also talk about safe touches. And that's really how they frame it, is like, what's a safe touch and what's an unsafe touch. But that's one organization, a great organization, don't get me wrong, but one for the whole Denver metro area that I'm aware of. But yeah, so there is a lot of prevention programming happening out there. Our office does a fair bit. The Title IX offices are starting to do more and more. Blue Bench has great prevention programming. The Healthy Relationships Alliance is where I used to work, and that encompasses multiple different prevention programs, from Project PAVE to the Conflict Center, DCAC, Servicios, a lot of great organizations. So the work is definitely happening, but we need more money and we need more people. So money, as Tommy kind of alluded to. So gaps. Yeah, where's the funding, right? 600,000? Yeah. That is so not enough to do this work and to do it well. And I also think another issue, too, is prioritization. So right now, schools, it's a really high-stakes testing environment, right? All we hear about all day long is testing, Common Core, testing, Common Core. This has to enter into the vernacular around what schools are doing, and we have to believe it's important. And that means giving people time to do it. It is really, really challenging to find time to push into a classroom to deliver any type of prevention education. And even if you can get that time, good luck getting a good dose, to be honest. You might get, okay, you have 30 minutes, that's it. Okay, better than nothing, I guess. Or, all right, sure, you can do this 5-week program, but we're going to have to shorten you. Each session can only be 30 minutes, and you get these 5 weeks and no follow-up, and, it's a once-and-done kind of situation. And we just know from a prevention standpoint that if you can't generalize the skills that they're learning, right, it's just not going to be as effective. So anyways, prevention in the future, more money, please. And more research. So I am really excited to hear that they're doing those research projects. I think that research is really needed as well. So yeah. Sorry, that was a lot of random information.
Yeah. So now we can. No one interrupted with questions. Is that? There we go. Is there more after? Should I have stopped on discussion?
Yes.
Okay, well.
Then there's a thank you.
Okay, well, maybe I'll just advance that. So what I have questions, but I'd rather hear from.
We don't bite.
Rush in.
I promise.
Yeah.
So
So when you're talking about, age-appropriate information, we're talking about very, very young, which apparently right now they're not well serviced, right? All the way to college or even adults. Some of us are quite ignorant about a lot of this stuff. But I imagine also there's differences according to gender, because the information that is given to, say, a 13-year-old boy would be different than a girl. So my sense is boys don't even think these sort of things can happen to them. And so how do you counter that from the get-go so that they even entertain it? Because I know even with the age, they know everything, right? I don't know how many of you here knows. Teenagers, they know everything. And also, on top of that, males not wanting to be vulnerable. And so where do you move them to the space? You mentioned that report, but I was thinking about it. I want to read it, but I don't know if this is something that my 13-year-old will want to read. So what kind of information and in which format did you bring it to them so that they get it even if they don't want to get it?
A lot of it is about just starting the conversation. I mean, that first conversation, you're probably going to get la 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 la, and no, go away. But even just, like we said, get those words in there and then keep up the conversation. It's not just one and you're done. And Anthony had said a lot of it for males is, many men or young men don't have necessarily a male that they can talk to completely. But Anthony had said that right off the bat, we need to talk about, he said, everybody in this room is vulnerable. I'm vulnerable. He even said him as an officer is vulnerable. And that's what people do, is look for that vulnerability. How can they isolate you? How can they make it easier so things can happen their way? And for young men, it's our responsibility as caregivers, parents, to talk about the vulnerability, but also the flip side of things, of consent, defining consent. And, starting, like Michelle was saying, some people don't like to be hugged and kissed. It's, you need to ask first, and starting from then on. But I can see what you're saying with your 13-year-old, and so that's, I think, all four of us are saying is why it needs to be getting into the schools. But
well, and I think to your point, as far as like how are kids going to actually pay attention, right? So I was the dean in a middle school, so I know this age group real well. And there is absolutely a way to get them engaged in the conversation, but it's really about talking to them about their own experiences. So it's having conversations with them about, like, wow, what do you see every day? Like, what do you see on YouTube? What do you see on commercials, whatever? So Project PAVE's curriculum, Path to Healthy Relationships, which is based off of Safe Dates that Tommy mentioned, it really is about engaging kids in this conversation about their own experiences and then helping them label things. So helping them understand gender boxes, helping them think about what does a healthy dating relationship look like what makes it healthy versus unhealthy. What are healthy communication styles like? What does it mean to communicate with somebody aggressively versus to communicate with somebody passive-aggressively? That one nobody gets when they're 13. Or to communicate passively, right? And so the conversation isn't an in-your-face, like, let's talk about sexual assault. The conversation is like, let's talk about our experiences, let's talk about healthy relationships, let's talk about and let's give you language, give you terms to go with what you're experiencing, what you're seeing in the media all the time. I wouldn't have your 13-year-old read this report. I think he'd find it boring. I think it would be great for you. And then you can absolutely, there's a lot of prevention curriculums that are out there that I think provide examples around how this work is being approached. There's a great, oh God. Okay, wait, I should know this. My husband did this. Catharsis does I can't believe I'm still blanking on the name of the thing. My husband would kill me. Catharsis is a company that does sexual assault prevention work, and they do an improv comedy show about date rape prevention. So they're using comedy as a way to get students, college-level students, to be talking about these issues. I think it can be the same at the high school or middle school level. So just how are you making it developmentally appropriate for that age group?
And I guess I would add, to expand this out a little bit more, that the conversation really is around gender norms and what it means to be a man or what it means to be a female, and what we're being told from a societal perspective what that means, and the limitations of that. And there's a lot of really great tools to use the media or music videos to kind of have that conversation so that you're not having to make the content talk themselves. And I totally agree that it's just start the conversation and create space to have that dialogue with your son is really important. But I think one of the most important things is that we don't isolate boys and girls differently in this conversation, because it's the same conversation for both, where both sexes are impacted by sort of how we narrowly define males and females. And that doesn't even get into the broad conversation that we need to have about transgender individuals and sexual orientation, all those pieces. But yeah.
Uh-huh.
I have a question. I am a school nurse in 2 high schools and 2 middle schools, and this is my first year in that world. I used to be in the emergency department, and so this is sort of my first place where I'm in an educational place doing healthcare. Mm-hmm. And so my question is maybe something that you guys know, but within the Denver public school system, or within maybe even like on a federal level, is there something that says that we have to give this kind of education to kids, or is that on a school by school, or is it on
local
the county?
control? Yep.
Okay, so does Denver have anything set that says that this needs
It's each school, everything.
Yeah, it's literally
individual.
Okay.
Because we have talked about trying to get into the schools, and it's like, well, why just can't we talk to somebody at DPS period? And it depends on the principal. So
what are you talking about? Prevention versus, you're not talking about comprehensive sex ed.
No.
Because that is a mandate in DPS.
Is it?
I'm 95% sure.
So you have to have some
But you can opt out. Or you have to opt in.
Opt out, or you have to opt in.
So at least, and I'm Jefferson County, so it might be a little bit different, but like for us, we're getting stuff home about you have to opt in if you want your child to have.
Is it during the school hours, Michelle, or is
That
it
is.
after school that your kid gets it?
It's during, it's part of their growth and development.
Science or something?
It's 5th and 8th grade, and DPS is when they get it.
And that's when they do over there too. But you opt in.
Is this something that is particular to Colorado? Or
No.
is it, I mean...
It's across the
is
country. That it's local control is pretty much the norm. And
around the country.
Mhm.
You know, I'm in a LA district. I remember having sex education in high school, and it was like everybody has to go through it. This is just part of the graduation requirements. I didn't realize that it was so individual.
Yep. And Colorado isn't the worst state. I mean, there's a lot of states that only offer abstinence. That's the only thing that you can, like by law, that's the only thing that's available. There's nothing like comp sex ed available. So, I mean, and to give some context, we actually do have like $10 million of abstinence-only funding in this state that's administered through the Department of Education.
And it's being used.
Yep. And oftentimes what we'll hear from our grantees who are working in schools is, so-and-so brought this curriculum in, and now the parents are calling us because they're mad because now the kids are saying X, Y, Z, you know. It's really complicated.
I spoke with a friend who has been out of school for just like 5 or 6 years, and she was saying that when she had her sex ed in 8th grade, it was all abstinence only, and they signed something saying they wouldn't have sex, and they all got a bracelet. So then how do you have the conversation about healthy touching and appropriate touching and making sure things are consensual if really nothing should ever be consensual, right? Because we don't do that until we're married.
Right.
I think you can still have the conversation. It's just that the outcome is different. You know, like, yes, this is not appropriate, but, you know, they make a commitment to not doing some of it. You know what I mean?
But I think
I'm not one of those people that say, okay, you know, you cannot have marijuana being legalized because that means I have to smoke it. I don't have to smoke it. You know, it's a choice. It's a personal choice. So I think bringing the education is one thing. Another one is to expect that just because you brought it in, you're going to have to do it that way. limiting people to being just followers and not having any personal will and power.
I think that when we don't share appropriate information about our bodies as like a biological piece, that if we don't share that with young people, that we're doing a disservice to young people.
Of course you are. That's what I'm saying. And you can bring it in the context of all of it about available, but just because they're getting it through in abstinence, to me it's like something is better than nothing. But not to say that somehow by saying the only way that I gain any education is abstinence is worse than having nothing. You know what I mean?
It is actually worse. The studies show that it's worse than getting nothing. Abstinence-only education does not work across the board.
And they don't give him anything else.
Right, correct.
So that's what I mean. They should be like, that's an option, but not the only option.
Well, and that's
so ultimately, maybe
Well, but if you're giving like a comprehensive, these are all
Right.
the things, abstinence is one of the
One part of
options.
them.
Yeah.
But if you're only doing abstinence only, those other things don't exist. And the way I personally feel is if you're just doing that, you should not be doing this. If you do it, it's wrong, it's dirty, it's bad. Not only are you not going to find out about contraceptives or STDs or stuff like that appropriately, but also if something does happen to you, who are you going to tell? Because you know what, you were making out with that person or you did this, and it becomes victim blaming all over again. You know, and then it keeps perpetuating that whole, it's your fault, so who are you going to tell, right? Because you weren't supposed to be doing that anyhow. So
that's what the parents, we talk about these things. Presumably. I mean, I had
not
conversations about that. It's really funny because I had a lot of these conversations about the facts of life when he was going into 5th grade.
Good.
You know, we will talk about all these things. When he got into middle school, then he turned more quiet.
yeah.
And so it becomes like, okay, you got to catch them early enough so that they're still comfortable with this idea, as opposed to, now it's not cool to talk to my mom about this.
Yeah, I was just going to build off of that. Seems like a big barrier as parents. You talk a lot about educating youth, which is very important, but then if you're not going to change that cultural norm if the parents aren't supporters, they're just going to fight back. So what types of education prevention programs, I guess more education programs, keep in mind for parents and to get them involved with it so that they are also educated on the whole spectrum?
So we do that as part of our programming, and what I will say on behalf of all of our grantees is that it is almost impossible to get parents to show up for whatever they're offering, and so I don't know that we know what we need to offer. We don't know how to get and engage parents to do that piece.
Safe Dates has that parental, it's the
optional
component, but
yeah, and there's
I
lots
haven't-
of curriculums, but they just,
Yeah.
if you don't get people to come, and that's the reason why I kind of, I have a hard time with the focus on schools because they're inundated with requests, and yet it's the one place where we can access a lot of young people at one time, so it makes sense that we're focusing on schools, but I would love to see work focusing on other venues where young people can be, including families, but I think it's the community approach, which you alluded to.
Yeah, and that community approach, I think, like, there needs to be more models created for how to do that. So on the grant I worked on previously, we had money specifically to do, like, parent engagement, and oh my gosh, we did so many different things. I mean, we tried to hold events at the school, not at the school, at other community events. We tried back to school night. We tried parent-teacher conference night. I mean, we were at that school or in the community in a lot of different places and just really were not able to engage parents in the conversation. And the overwhelming sense that I really got was not that parents don't care. I think parents absolutely care. I think more so that a lot of the parents we were working with are so overwhelmed and they have to prioritize. And a lot of times the priority is like, what's going on the dinner table tonight? Like, okay, where am I going to work tomorrow? You know? And so it can be hard sometimes to engage in the longer term thinking.
And one of the important things that you guys are referencing is someone is building on other prevention efforts.
Mm-hmm. Yeah.
And I'm part of a couple youth violence prevention programs, and there's something that goes on in several different venues. I don't know if you guys have heard of Strengthening Families program offered through juvenile justice, and we have a program out in Montbello, and there's tons of money, the marijuana money now, that's being leveraged for that program. That program is a 7-session program Kids and parents are split up the first hour, then brought together for the second hour. Dinner's provided, daycare's provided, and tons and tons of parents and families are taking advantage of that. And they've been served around the Metro Denver area.
That's great.
I think, not tons population-wise, but my guess is there have been at least maybe 12 to 15 cycles offered in Metro Denver this past year. And there's money on the table to probably do maybe 25 of those. And each session will serve 10 to 15 families.
Wow.
So linking up with those organizations, making sure that, and they do have, of the 7 sessions, there's some stuff on healthy relationships. It's not all violence or sexual violence prevention, but certainly they bleed into each other. And making sure any program that you guys get involved with measures all these multiple violence outcomes, which is key. And I think being involved with this work, every type of prevention program is going to broadly affect each one of our specific areas that we're interested in.
Yeah, I agree. I think you had a question in the back there.
I was going to ask about different media, like the kinds of intervention and prevention programs requires a lot of, face time. Has there been any work on like mHealth, go to an app? You can do that anytime, anywhere. You don't have to worry about reorganizing your life to go to the after school.
I know that there's some apps for bully prevention. I'm not super familiar with what they are, but so interestingly, CU Denver, and I think Metro, and I know DU, they have a new requirement where all students have to engage in an online module around sexual assault prevention or interpersonal violence prevention. Someone in our office actually built the one for CU Denver. And I can't remember if it's just for freshmen or if it's every year they have to take it. Do you guys know if it's every year?
It's every year.
I thought so too, yeah.
But I do know at Metro right now it's not a requirement.
Okay.
Though at CU Denver it is.
Yeah, at CU Denver it's a requirement. I know at DU it's a requirement. So I think that the school, like at the college level, they're starting to explore what that looks like. I don't think we have a lot of great data on how effective or not that online training is. Sometimes I feel like it's a little bit of a Title IX CYA, like, oh, look, we gave the information. How impactful that it is, I can't really speak to that. It's better. I think it's a good step in the right direction. So, yeah.
Just want to say, I really like the new graphics, but there does need to be the word rape or sexual assault or something like that on there. We just need to get that in our language, that it's something safe to talk about, ask about, things like that, especially in education. So I like that you guys are talking about that and thinking about it. Because there does seem to be, I've looked, my daughter is in first grade, and I was asking my husband, so when does sex ed, and how does that all come about now? And we know with obesity rates being a lot higher, that kids are going through puberty a lot earlier, talking about their bodies, changes, things like that. I can't wait till 8th grade, if you ask me, but there are no standards in the U.S. It's what teachers want to teach, districts want to provide, funding, all of that stuff, which I'm just enamored with from a public health standpoint, and that's not talked about. And just looking into that and looking, at the abstinence programs and how much religion gets involved in public health and families, all of this just needs to be educated on how to be supportive of children and women and men and families. Because if you're told that, like you were saying, abstinence is the only way, and if something happens to you, who do you talk to about that? That's creating that downfall that you're not going to have a good quality of life because you don't have that support system if something does bad happens to you, and how do you bounce back from it? So we work on the car seat program, and I wanted to get flyers about the laws in Colorado and how kids should be in car seats going to school to look at the use of booster seats and things like that, because people aren't obviously following the laws and using them. And I tried to get a car seat handout into the Fridays holders.
Have
fun.
So I can imagine talking with families about sexual education and rape and things like that. But I just think it needs to be
it really does need to be talked about and not a dirty word. And as much as it's not going to be sexy or appealing to be on, you know, the new banners or branding or anything like that, I think that we need to find a way to do that. You know what I mean?
Well, and I think
I don't know how you do that though.
if you open up, if at some point in time we're able to actually truly open up a dialogue, right, and we start to change society. I mean, really, that's what it is. It's not just the kids. So maybe if we start getting in with the kids and we get them when they're a little bit younger, even if the stuff at home isn't so great and they're not getting the same message at home, those kids then grow up and then they start having kids. And do you see what I'm saying? Like, we just need to kind of get started and get momentum on that. I mean, and it goes across the board. Do you know how difficult it is to prosecute a sexual assault? Like, and I'm being very honest. It is because people weren't there. You know, it's usually one of those things that they...
He said, she said.
He said, she said. I mean, I've heard of instances where he said it never happened, she said it happened, they found DNA. He said, well, I had a girlfriend, so that's why I lied. And he got off because the jury didn't like the victim. Mm-hmm. I mean, and there still are people who are like, well, where were you at? What were you doing? What were you wearing?
Mm-hmm.
You know, so
Why'd
I mean...
you drink that much?
Yeah, I mean...
Well, what you were saying that people might come into your office now that they're in college, they moved out of that home they knew where they were being abused, and it's been 10 years since the incident happened.
Yeah.
You know?
I'm amazed at how much of that I've been seeing, a lot more than I expected to see, to be honest. And it made me really reflect on my time in K-12 and just sort of thinking about, you know, how are we training staff to catch things? How are we teaching kids, little kids, you know, that you know, that good touch, bad touch that you can tell. Yeah, I mean, it's been really interesting just thinking systemically about these issues. And it's interesting. So in the report, there's a whole section for risk and protective factors that are societal. So like, there's the individual risk factors, there's community, right, and then societal. So sometimes on my more burnt out days, I started thinking about, okay, like we're exhausting these individual areas, right? You know, what are we doing on some of these larger societal areas? I think that those are harder questions because we're talking about things like poverty more generally. So, but there's a part of me that really thinks we need more attention to be paid on that. And that's really the public health side. So like I'm a social worker, so most of my brain power is really dedicated to the individual, but, you know, I hope that other people's brain power is thinking about the societal piece of it.
So maybe next step, just for that younger child there, this might be out there, I have to look into it, but just maybe some question and answers or some facts or phrases you can kind of talk about with children across the board.
Yeah.
Because statistically, it's someone that you know, so
yeah.
Our kids, you know, if you had a problem, go to this person because they're safe, and
that person might not be safe.
I mean,
yeah.
You guys do amazing work. And
thank you. To your point, so there's actually a law called Aaron's Law. Is anybody familiar with it? Yeah. So Aaron's Law is a law about providing sexual or childhood sex abuse education prevention work in K-12, mostly K-8, whatever, K-6. The Colorado version that passed is really interesting. I think I don't think it's true to the spirit of what Aaron's Law is supposed to be, because it's only providing one position at Department of Education who can provide like consultation to the entire state of Colorado around childhood sex abuse prevention programming.
The way I understood it too is like you can have somebody mention it at a announcement, and you're good.
Yeah, there's no true accountability. There's no real mandate around what it needs to look like from a quality perspective. And I guess it's better, again, there's this, is it better than nothing? Probably. It's probably a step in the right direction, but I think it's interesting that that's what passed in Colorado, but much more robust versions have passed in other states.
Well, I mean, we have a history, everybody was doing it right, because that's the other point, right? You can complain, nothing happens. But if there may be some models out there to look forward to. So you say you have your own, cases where you have put out programs and they don't work. So why don't they work? Because there's something that somebody else who does really work for them. They figured out what that was.
Sure.
So sometimes, just emulating what has been done elsewhere, not necessarily blindly, but to learn from that experience to see
Sure.
I'm sorry I talk like this, because I'm an engineer, so all problems have a solution if you determine why. So look at, what are the things that are working, integrate those, and the things that are not working. And so not being able to engage the community, I understand that, because, especially with racial color, sometimes it's a cultural barrier, language barrier, it's not to be dismissed. And so all of these pieces that have worked somewhere else, there's got to be something useful to, that you can bring in. I live in Boulder. Boulder does some stuff at the third grade. Blue Sky, which is I think a nonprofit somewhere, comes and presents to the parents after hours about child abuse, and and they talk to the children too. I don't know if you're even aware of these things. I mean, there are programs out there that are doing something, whether they're perfect or not. You're telling me that there's.
I think that
it's hard to even assess them.
I think what the challenge is that it's patchwork. There's no systemic direction to it. It's we get whatever time you're going to give to us, and we can't get into this school this year because the principal changed. So that's, I think, the bigger barrier is that we know people are doing really good work and trying really hard to address this issue. It's difficult when you don't have the larger contextual support to do it. When a presidential candidate says that all Mexicans are rapists, that impacts. You know what I mean?
And that's why I am so honored to have been able to convene this panel and do this work, because I feel like we're engaging a bunch of stakeholders from different areas so that, we can sort of cherry pick, okay, this is working over here, let's incorporate this over here. But it all goes back to Kylie's point, more money, please. And, whereas if we could do, if we had unlimited funds and we had all of these ideas, we could do something on an individual level, a community level, a societal level. I mean, because changing social norms is a long process. It needs to be done, it needs to be started, but getting things moving forward and public health is a great area to try and combine different perspectives. The already existing public health perspective, the clinical perspective, the law enforcement perspective, all of these different things to figure out, hey, what can we do that can work?
Do you guys have any statistics in terms of, time, I don't know what you call it, time history. I did postmasters in public health, but my area is air quality, so it's the relationship between air pollution and health. But I really like the field of public health because, you can bring these perspectives together and come out with something, creative for, solving the problem. When you look at the problems that we have right now, are we talking about the same rates? Are they increasing? Are they decreasing? We know more now, or we know less. I mean, put something in perspective with respect to, are getting things worse, or are they getting better?
It depends
the same.
Well, it depends.
Results that you look at, and the National Intimate Partner in Sexual Violence Survey is one of the biggest surveillance tools that the government has. Who puts it out? Is it CDC?
Mm-hmm. So measurements are finding at the same time, and reporting is affected by cultural factors too. But I actually want to take control actually and close this up, where I'm noticing people filtering out, so I want to be respectful of people's times, but maybe we can continue this discussion in case people have other places they need to go.
And so I want to thank the panelists for coming today, and I'm so glad that you brought handouts.
Congrats.